Local anesthesia, Nasopalatine Block. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 27-gauge short or extra short needle, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The nasopalatine or NP block is useful for anesthesia of the bilateral anterior palate or maxillary anterior sextant from maxillary canine to canine, including the maxillary bone as well as the lingual gingival tissue. The injection is useful on the more difficult non-surgical periodontal therapy cases that are treated in sextants as well as in patients who have extensive lingual deposits in the region. Both the right and left nasopalatine nerves are anesthetized with this block. Therefore, only a single injection is needed for both sides of the anterior palate. The NP block does not provide pulpal anesthesia of these teeth, so the anterior superior alveolar block, or the IO block, may be indicated as well and is usually given before this block. The landmarks for this injection are the maxillary central incisors at the palatal midline and the incisive papilla. Both the right and left nasopalatine nerves enter the incisive foramen from the mucosa of the anterior hard palate. The deposit location or target area for the NP block is the incisive foramen beneath the incisive papilla. However, the needle insertion point or injection site is the palatal tissue lateral to the incisive papilla, which is located at the midline. Never insert the needle directly into the incisive papilla because this can be extremely painful. Perform pressure anesthesia with a cotton tip applicator on the palatal tissue on the contralateral side of the incisive papilla. Applying pressure anesthesia with the cotton swab for 1 to 2 minutes before needle penetration will help make this injection more comfortable for the patient. Load the local anesthetic syringe as demonstrated in the procedure loading the metallic or plastic cartridge-type syringe. Before the injection, follow all steps as demonstrated in the procedure, basic injection technique. Assume the correct operator position for a right-handed clinician at 11 o'clock and a left-handed clinician at 1 o'clock. Ask the patient to open his mouth and extend the neck comfortably backward. Dry the penetration site and prepare the tissue with topical anesthetic on the lateral side of the incisive papilla toward the operator, placing pressure on the papilla. Topical anesthetics are most effective for patient comfort when applied for 1 to 2 minutes. Dry the tissue to remove excess topical anesthetic. Using a 27-gauge short or extra short needle with the syringe in the dominant hand, orient the bevel of the needle toward the hard palate. Using a new cotton tip applicator in the non-dominant hand, apply firm pressure directly to the contralateral side of the incisive papilla, away from yourself until tissue is blanched, and maintain pressure with the applicator throughout the injection. Advise the patient that he may feel some slight discomfort from the pressure. Establish a fulcrum that allows you the greatest stability of the syringe. Direct the syringe at a 45-degree angle toward the base of the incisive papilla, with the large window facing you. Insert the needle approximately 3 to 6 millimeters into the tissue on the lateral side of the incisive papilla towards yourself until you contact the maxillary bone. Meanwhile, maintain pressure on the contralateral side with the cotton tip applicator. Aspirate by pulling the thumb ring back gently on 1 to 2 millimeters at the injection site to prevent the possibility of an intravascular injection. If aspiration is negative, slowly deposit approximately 0.45 milliliters of solution, 1/4 of the cartridge, over approximately 20 to 30 seconds. Tissue in area will blanch even further when the anesthetic is administered. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. Rinse the patient's mouth and wait approximately 3 to 5 minutes until anesthesia takes effect before beginning treatment. Complications from this injection are rare.